In today's Eye on Health, we are focusing on matters of the heart, specifically for women.
Cardiovascular disease is the #1 killer of American women, and too many women, especially younger women, remain unaware of that.
And too often, pregnancy can lead to stress of the heart, and women can develop something called preeclampsia. Mikey Hood sits down with AHN cardiologists to learn more about how they can help women through the process.
Every minute, we're losing one woman due to cardiovascular disease.
Dr. Valentyna Ivanov is a cardiologist at AHN Women's Heart Center and the director of their cardio-oncology program. She tells me that pregnancy, though an exciting time for many, is often the first real stress test for the heart.
During the pregnancy, the hormonal changes that happen, they lead to increase in amount of blood that our vessels carry. And also the heart rate increases during pregnancy, and it increases the output that heart produces every minute.
And if there is a pre-existing condition like congenital heart disease or high blood pressure, pregnancy can be challenging.
Let's talk about preeclampsia, because that is one condition that affects a lot of women that arises out of pregnancy, right?
Yes, exactly. This condition is only related to pregnancy. There is no preeclampsia in non-pregnant women. Mainly, this is one of the diseases of high blood pressure.
They call it a disease of the placenta, where hormonal changes cause elevated blood pressure and can lead to damage in the heart and other organs, even seizures if not treated.
I just want women to be aware that if they had already preeclampsia during the first pregnancy, they are at much higher risk to develop preeclampsia again, and maybe in more severe form. And obviously, the earlier in the term, and the early in previous pregnancy, they developed elevated blood pressure and preeclampsia symptoms, the higher or more severe it could be during the next pregnancy.
Pregnancy after 35, women who use in vitro fertilization, and women with other pre-existing conditions like kidney disease are more likely to develop preeclampsia. Early detection is key.
We're trying to make it unique because we're trying to establish a relationship with a woman even before she becomes pregnant, or maybe at very early stages of pregnancy, as soon as she knows that she is pregnant.
The cardiology department opens their doors to women, especially after age 35, to assess for any risk factors of heart disease. Alicia Booz, a teacher from Ingram, came to Dr. Ivanova already pregnant, but with high blood pressure too.
I was pretty terrified. Without going into too much detail, I had a history of pregnancy loss, and had 2 pregnancies that I did experience high blood pressure in.
We settled down that, okay, we reverse our course and we'll start other ways of managing her cholesterol levels.
She was very reassuring, very careful and meaningful about choosing medications for me that were safe for pregnancy.
And 9 months later, they welcomed a healthy baby boy.
His name is Nicholas Salvatore. He was born 3 weeks early, but was scheduled, and he's perfect.
Those stories and many more kind of make our day, and we will be happy to help every single woman who would like to come and start from pre-pregnancy, throughout pregnancy, and after pregnancy follow-ups, and we're here to help you through it.
I'm Mikey Hood for PTO.
Really important information. And you know, I've talked about this before on the show, but I had preeclampsia with Lila and a mild case with Rocco. No pre-existing conditions for me.
Right.
I was 29 years old when I got pregnant. I didn't think for 1 second that I would have any kind of unhealthy pregnancy or any conditions arise in my pregnancy. And I mean, thankfully, I had some wonderful doctors who spotted it and knew. They could see the swelling.
Right.
All of that. So
kept an eye on you.
Yeah.
Yeah. It's really just making women aware, which is why telling stories like that is so important.
So important, yes.
And remember to keep watching for our Eye on Health series here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.
And watch Friday's show for a special report on heart health and all women for the American Heart Association's Go Red for Women campaign. You'll see us in red.
Yes, we'll be wearing red.